Subscribe to our YouTube channel and press the bell icon to get the latest updates.
The second wave of the COVID-19 pandemic has been described by many as being one of the most traumatic episodes of this country's history. For about a month, the official COVID death toll had remained between 3,000 to 4,000, even rising higher on some days. As hospitals across the country came under enormous stress, we witnessed scenes of patients waiting outside and even, succumbing to the disease for the lack of medical attention and oxygen. Today we have with us Dr. K Sekar of the Center of Psychosocial Support in Disaster Management at NIMHANS Institute in Bangalore to tell us about the extreme, the kind of mental health toll which comes from this extreme crisis. Welcome to ThePrint, sir. So this has been perhaps an unprecedented crisis which we have seen, just in terms of the sheer number of deaths which have occurred, the way in which these deaths have occurred. People have lost their loved ones, several children have been orphaned. So you are an expert in community mental health as well. Can you tell us about the mental health situation as it stands right now in the country?
Well, as we talk about the mental health situation in the country, especially for this particular pandemic, I would like to relate it to the type of a disasters. Any sort of a pandemic or epidemic or a disaster of a biological nature usually affects 95% of the people immediately after the thing strikes into picture. So if you are going to recall the way back March 2020, almost 95% of the population had reactions to the pandemic in varied ways because never the country has gone on to a lockdown historically, except during the war with China when people were asked to stay back at home and put off the lights after 7 o'clock in the night or minimize the light and all. That was all the maximum sort of a dark down issues what we had in our life. But none of the Zennials or none of the millennial kids have ever undergone this sort of a lockdown. So the first and foremost issue which came up in the thing was a reaction that I had to be isolated back inside my home alone, need to keep a physical distance. Wearing mask was not a norm for us at any point of a time. So putting on the mask and maintaining the other one and people talking about keep sanitizing your hand and other things was a very major sort of a routine change which occurred. More than that, the social fabric got into a problem because they were confined to a 10 by 10 or the other type of a structure wherein they were not able to go because globally when you look at Indians, they are social animals. They cannot be on a individual level at any point of a time at all. They have to be with group, they have to be with community, they have to be in a workspace. That was a sort of a thing which was there in comparison to Europe where it is not that sort of a heavy sort of a isolation because they are isolated most of the time and all. So this is number one major sort of a thing. But subsequently what happens when the disaster comes down and other thing, usually it is about 65% of the people will be affected over a period of 6 months and there would be a reduction of almost 30%. Later on it would come to 30% over by about 2 years where there is a loss which is much higher and normalcy will set coming inside about 3 to 4 years, which comes down to the natural sort of a prevalence of mental health problem, which is about 10.7 in our country. So even in a normal population, one person out of 10% does have a mental health issue. But at this point of a time, I would like to inform that the reactions are quite higher and it is 2 out of every 3 person does have an issue of a mental health concern. I will not say that they are mentally ill. 2 out of 3 persons do have a concern in terms of the mental health of themselves. When I'm meaning this, these are distress, these are reactions to the loss of a loved one, what you said about it. In the first wave, it was only an isolation and individuals were keeping away. Now it is an issue where the family has to be totally away. The virus is the same. But the earlier virus was affecting one person in a family, but now it is affecting 3 to 4 persons in a given family. Earlier, though the death rate in both the things have remained the same, the number of deaths have increased in the second wave. And in any sort of a thing, life event, when death of a beloved one or a loved one occurs or a near one occurs, that causes the highest stress for any human being, not only in India, internationally. That is a highest stress sort of a thing. But here, the thing is that a large amount of persons do have a grief wherein they have lost a loved ones, which is very true. But the problem compared to the other one, where they could see a dead body, where they could do the rituals, where they could cremate or bury the thing, is not occurring here by the loved ones. For reason, if it is a COVID death and it is a positive death, the body is not handed over to the family, except for the information that it has been. So people think, I have not done what I need to do. And they immediately have a guilt. So there is a prolonged sort of a grief reaction which is currently going on, not only in the minds of people who have lost their loved ones, but also the children who have lost both the parents or one of the parents with whom they were there.
So, sir, in terms of the response to this surge of grief, a lot of experts have said the natural response is resilience. And many have quoted, the Kubler-Ross model, which is the 5 stages of grief. They've compared it to George Bonanno's 4 trajectories. So where do you stand on these responses, to this grief?
Theory on one part of it. When we are coming to the practicality of the other issues associated with that of the grief, first and foremost, I would like to communicate, let us not equate grief to depression. Both are totally a different sort of a process. Anyone and everyone who have had a loss need to undergo the grief, which is a universal sort of a factor, not just Indian. But there had been protective mechanisms in India in terms of the cultural factors. And that protective mechanism even now is playing, though it is weakened, it is playing its part in terms of giving the particular resilience to the family members. Like the community still is not keeping quiet. At least the close relatives are in touch with the family members on a virtual mode or on a distance mode of getting the thing.
So how would you compare, the stress, trauma, grief, which comes from such a long-term event, such a long-term disaster versus one which is more short-lived, where the stress might be immediate, but the event itself is shorter?
You're pretty right. In most of the disasters, it is based on the epicentric and the spread of the epicenter to what level it goes. And there we divide it as zone A, B, and C. That is the outermost ring sort of a thing. I'm not saying that we have not experienced any disaster. We had been experiencing disaster even during this particular pandemic. We had 2 major sort of a cyclones passing through our country. There had been floods and there had been deluge and other things which we had been going on. But they were all limited geographical area. Here it's a nation and the international, entire globe is being affected. So that is one of the largest sort of a thing, number one. And it is not that there had been protracted disasters in certain areas, which had combination of both the natural as well as human-made sort of things, and they were a bit complex. But to this sort of a disaster, pandemic is a much complex sort of a protracted disaster, and this is going to definitely have not only a sort of impact on the people, but also on the neurological as well as the mental health of the people, because the post-COVID persons who are there are crossing millions. People who have got infected or people who had been affected, though we say they came out successfully, and this is a rate of thing. These people will have a minimal of 3 months to 6 months, and in some, there could be a thing by the time they regain their cognitive, their ability to have the smell, the ability to taste, all these things might take anywhere from 3 months, 6 months to a year. And some of them might have physical symptoms of having lost weight and other things and unable to have a good appetite, sleep disturbances, and other biological issues, which would be combined along with this. So we are going to have, on the other hand, the large health parameter, which is going to be questioned, just not in terms of containing the pandemic, but the fallout of that and how are we going to look at the rehabilitation of these people in terms of getting back to a healthy lifestyle.
So we have seen the way that grief is also manifesting in people who have not directly been affected by the pandemic. They have not necessarily lost a loved one, but in terms of just consumption of news, consumption of the day-to-day events of this pandemic has sort of induced this kind of trauma in them. So how would you differentiate, how does trauma and stress manifest differently in these individuals who are not likely to have been directly affected, but their mental health is still suffering from this?
Sure. There are three aspects to the thing. Number one is that there are general stresses associated always with any sort of a pandemic. This is occurring with 95% of the population, what I told you. Even today, when you're walking out of the house and if you have forgotten your mask, there is an immediate sort of a anxiety which comes into you to rush back to the thing rather than just taking up a handkerchief and putting it on your nose. So what are the things which are there? The social isolation and the restrictions which has brought in are affecting a large number of people. Especially the adolescents do not want to be at home. They want to be along with the friends or they want to be onto the thing. The workforce finds that the work environment back in the office is much better compared to being at home. Women who are having both the work at home as well as taking care of the home are finding difficult to set up a home within the a working place within the home per se. Followed by these general stressors, there are something called as a traumatic stressors which are there, wherein the person has been infected, the person has been affected, he has been isolated, he has been sent to a COVID care center, he had been on quarantine. And when in quarantine, the first 4 days are fine. I am still able to spend my time along with the mobile, keeping in contact with other members and all. The fifth day onwards, the social isolation process starts in. The person, some of them who had gone through this, say between the 4th day and the 12th day, I don't know how I was undergoing the mental agony. And that's a point of a time, the traumatic stressors in terms of whether I'll be alive or I'll be dead and I should have done something, including small indicators. I should have written a will. I should have done this thing. I should have completed that work which would have kept my family to a better thing. I have not put in where all I have invested and other things, to whom all I have need to give money. When these sort of thoughts are coming, they had been much problematic in terms of having a thing. And when they see death occurring just in the third bed from them, that creates a sort of a panic into them. And the extreme exposure of these sort of details to them impacts traumatic stress related to COVID. And today, the Diagnostic and Statistical Manual of American Psychiatric Association has started coming out with new COVID extended sort of a diagnostic criteria. And one of the criteria is what they have lessened down in terms of the duration is the post-traumatic stress disorder, which earlier, for us to see a classical PTSD would have been 3 months to 6 months, but now 1 month is a sort of a factor what they have brought it down. So here, again, there is a thought which intrudes in the mind. They don't want to think about it, but they still keep thinking about it. Information of it pops up the moment a SMS comes in or a WhatsApp message comes in. It's not only that intrusion of thoughts, but also memories and vivid pictures like what we see on a TV screen. The scenarios keep coming back to them based on some of the newspaper clippings where they see mass burials, or in the Ganga, the bodies of the COVID-19 patients are being exposed after the floods, or the cremation which is occurring in mass when it is being there, or seeing ambulances lined up in front of casualty, asking for a bed or an oxygen concentrator or oxygen support. All these things brings in a hypervigilance, wherein the heart starts pounding and they start perspiring and already the lungs are a bit weak. In that, they start giving in a large amount of breathlessness and other things. And apart from the heart pounding, they start getting sweating and other issues, which brings in a hypervigilance into the thing. So apart from this, the amount of anxiety is also found to be much larger. Something as a coronaphobia is also coming into picture. And large numbers are going to be affected on a psychosomatic. All these psychological problems are going to play a major role on the somato, which is a physical. So from simple sort of a reaction to that of a symptom, We are talking about a syndromal presentation which is emerging today, and this is going to affect just not the 10% of a usual population what we see. It might be at about 30% on a long run.
So NIMHANS also runs a national helpline for people who are, facing these COVID-19 related mental health issues through several institutes across the country. In the past 2 months, how many calls how many people have dialed into this helpline, and what have these calls been about? If you can give us a comparison between the first wave and the second wave.
Good. So far, over the period of a time, we had about 4,48,000 calls, and we are following up about 53,500 calls even as on today. And
Since the helpline started.
Since the helpline started in March 2020, but we reached a plateau somewhere in November through that of mid-March or late March, I can say, wherein the number of calls was only about 2,000 per month or 3,000 per month. But we saw a spike, and the spike went up in the month of April, May. It started touching 14,000 per month and 17,000 calls per month as of April, May, when the surge was much, much higher. Current sort of a wave 2 is more on the fear that I would get corona, that every other family member will get corona. And they are saying that this is much more a major sort of a virus, that it doesn't leave. So fear of death has come into the larger play. The moment fear of death comes in, a large amount of the persons had helplessness, hopelessness, worthlessness, and some even had contemplated on suicide and other issues. And the break of the social fabric we were able to see to a larger extent, because it was not 1 month or 2 months. It is over 15 months, as you rightly pointed out. So the type of keeping a physical distance, keeping away from the regular routine things which should have occurred, and for the students community it had hit badly, not knowing what is going to happen and what is happening, whether exam is there, exam is not there. Getting into a new normalcy of learning on a virtual program itself was too hard for students in the peri-urban as well as the rural area. And associated sort of a thing that I'm not getting connectivity. These were the type of things which came in, have got into a fatigue, and a large number of them are undergoing a burnout situation because they have been pulled to the larger extent. This could be the police person, this could be media persons like you, this could be the healthcare providers, and we can't expect much larger than what they have provided because the situation is prolonged. They had been pulled to the maximum extent possible.
So I want to talk about another section of the society, like you had mentioned, the children and the adolescents. They've been locked up in their homes, access to education, access to, just being around their friends, social interaction has been curtailed. So also, right now in the second wave, they've had to cope with the loss of loved ones, more cases in their family, more paranoia in general, etc. So what is the kind of impact that, is likely to happen on these children, on these adolescents currently?
Well, the adolescents and children, most of us might have thought that they don't have any reactions, it doesn't have an impact and all, which is really wrong. Right from a just born child to that of a young ones too, we have to look at in categories of children, between the one which are within 5 years, 0 to 5 years sort of a thing, 6 to about 11 years or something, and the adolescents starting from 13 years to 18 years sort of a issue. Each one of them are having much larger reaction. For reason, there could not have been a death in the family, but one of their classmates' father passed away, who used to take them on that two-wheeler to the school. I do remember that uncle who used to give me a drop. Now, 2 miles, whether my friend will walk along with me or I have to walk, I'm not sure. That particular teacher was so good along with me. I was a pet of that teacher. Based on that, I was able to do my mathematics to a much larger extent. I came to know that she passed away. So these sort of informations, more than that, when the grandpa and the grandma, who were the sort of a stress busters for them as well as a cushion for them, have passed away. Worst onto these sort of issues are that I am not able to be along with my friends, then that gave me a large amount of lessons for me to read and write or things like that. I was dependent. Today, when they are talking something, I don't know what they are talking at all. I am totally in a sort of emptiness when they are talking about it. And people are compelling that I need to sit through and listen to it. Whereas in the didactic lecture, what they were using, the board and other things, at least I used to write down what was there in the board, I was able to recall. These are the sort of reactions what the children or the young adolescents or the adolescents who are talking about it. In terms of adolescence, it is a prime period for them to show that they are becoming adults and they want to be a group leader. They want to show that I know an answer for this as an adult. And sometimes they keep blaming the other ones. You're a small boy, you don't talk about it. Then they want to show their might and other things and all. But now that is not occurring, even on the mobile and other things and all. So that has been creating a large amount of worrisome among the children as well as the students and the young adolescent sort of a community. And some of them are getting into sort of addiction and other things, not only to the drugs or to alcohol or things like that. Even the internet addiction and other things are on the rise. So one has to be a bit careful on these sort of other issues which are arising among the adolescents and the other ones.
So, also in an article that my colleague Sandhya Ramesh had done on, just the kind of grief that we experienced in the last few months. So a few experts she had spoken to had said that there should be an institutional response to this grief, very similar to the kind of thing they had seen in post-apartheid South Africa, where they had set up this Truth and Reconciliation Commission for, both victims and perpetrators to sort of speak and talk about what they have experienced. So do you think that, such a measure would be helpful for what we are going through right now?
Definitely. And as an institutional mechanism, the National Disaster Management Authority had a review on this about 3 weeks back itself. It's not to go on at that point of a time, the wisdom prevailed among the members, as well as when I was asked for give a opinion on to it, we said it is not going to be at a one-to-one sort of a thing because the numbers are lakhs and lakhs together. So one of a larger decision we took was that it should be a community-based sort of a approach to go about it. And we are seeing some of the faith-based leaders doing it. And there are some of these churches as well as a mosque and some of the other Hindu religious places have initiated some activities onto this because most of the time your rituals and other things are associated with your religion and other sort of issues. And it has to be the community responders who are to be at the much larger thing to participate among the family. So NIMHANS has now started a psychosocial first aid capacity building for all the states. We have now completed 4 states, Puducherry, Himachal Pradesh, and now Punjab, and we are now taking on Assam. There is a government Ministry of Health and Family Welfare, particularly to look at the current surge and what is the first aid we need to keep doing, and there the grief, how the community needs to respond as a response for it. We want to provide this mental health shield as a COVID shield for every person by making the community responsible for it rather than an institution like NIMHANS or others being. So we can be facilitators and we can just ignite the thing, but the fire has to be caught by the community. And we feel community is the right sort of a group to provide the type of a care what is required for one of the person in their own locality or their area.
And finally, sir, what can we do as individuals to kind of mitigate, this grief, this trauma, and prevent any further mental health challenges and complications?
Be supportive to the family which has lost a loved one. Be available to them in terms of the need virtually rather than being physically. See that if there is a need for them based on what is the life cycle they are having, what is the type of a support you can extend to them. For example, if it is a woman who has lost her husband who is in a middle age, what is happening to the child? She might be thinking about the child and other thing. And always keep a window open to see whether the person is there, because sometimes because of the helplessness, hopelessness, they should not get into a self-harm or a total sort of an idea of taking away their own sort of a life. And do not penetrate too much in terms of dissecting what are the finer most issues when the person was in ICU, this, that and all. Avoid that, because that could create a traumatic sort of a thing. But generally keep saying that it's a loss. It's not a loss only in her or his family. It's a loss throughout the nations and not just in India. Okay? So some sort of a talk, being supportive, making them perceive that I am there for you itself will pull them out. But this time it would be a little delayed compared to the rest of the disasters. So you have to be much supportive, you have to be educative to them, and less intrusive into them or intrudeness into them. Allow them the space, allow them to talk about it, cry about it. Don't go into nitty-gritty details of the issue.
Thank you so much, sir.